Will you still need me? Will you still feed me when I'm 64?
Good morning to you. It is Saturday, June 12th. And we've got a new segment, started last week, new segment from 7:30 to 8. One of our Ask the Experts now has his own show. I'd like to introduce him this morning. This is Dan, and he's with Silvertone Medicare, right? Is that what it is?
It's Silvertone Med Plans. Good morning, Susan, and good morning to our listeners. We're happy to be back for our second of many weekly shows here, discussing Medicare and all of its complexities on that. Last week, for our first program, we covered the A, B, D, and C's of Medicare. And a quick recap of that is that everyone needs Medicare Original Part A and Part B. And in most cases, they'll also need the prescription Part D plans, unless they have a good plan from an employer, and that's as an active employee or a dependent of an active employee, and that employer has 20 or more employees. If you're on Medicare for disability, the employer count is 100. So that's the lone exception of who does not have to enroll in Medicare. You want to do it the first of your birth month and plan a couple months ahead. Now, Part A, Original Medicare, is premium free for most, but Part B does have a monthly standard premium, and that premium this year is $148.50, and with higher premium amounts for incomes for single filers at $88,000 and joint filers at $176,000. So that's your Medicare A and B. You get 80% coverage, therefore you'll need coverage for that unlimited 20% that Medicare doesn't cover. You'll also need prescription drug coverage. And that's the topic for today's session, which are, what are my Medicare options? Now, have you received the Medicare and You guide or book for 2021? It's a pretty lengthy book. It's about 150 plus pages. And if you happen to have received that, we're going to be following most of that content, on our weekly broadcast here. So if you have it nearby, we're really in the early part of that book, pages 6 to 8, and for your reference. So you're going to hear me state a couple frequently statements, that is, about Medicare. And one of them is that Medicare is confusing on 3 levels. And that is when to get Medicare, how to manage your prescription drugs if you have, a complex drug list. And by far the most misunderstood part about Medicare is our topic today, which is what to get on top of Original Medicare. Now, I'm just going to take a little sidetrack here and explain why it's so confusing and why the vast majority of people don't fully understand the enrollment periods for these Medicare plans. And I believe the cause of this confusion is that, as we'll be discussing today, there's 2 separate and distinct ways for you to get your Medicare plans. And those separate ways lead to separate markets, and these separate markets have different times on when those plans may be made available to you. The plans and markets also work completely different, and they're priced completely different. But the confusion lies is, let's look at it from the average Joe or Jane's perspective. If anyone is in Medicare, you kind of have to have your head in the sand not to be aware or know of that Medicare open enrollment period every October 15th to December 7th. the airwaves, the mailboxes, everything is loaded. And, again, most people that are in Medicare are familiar with that enrollment period. Now, look at it from, again, that average Joe or Jane's perspective. They know about this annual period known as the Medicare open enrollment period. So isn't it perfectly logical for them to assume that if it's known as a Medicare open enrollment period, that no matter what your Medicare plan option is, that you have a right annually to change? And I have to look at it again from their perspective and say, yeah, that's perfectly logical. And that's a common assumption that most people make out there. And it's the one area that can get you in a lot of trouble. So here's the clarity on that. That Medicare open enrollment period that everybody refers to, even within the industry, is actually known as the annual election period, AEP. And what it is, it's an open enrollment period, an annual open enrollment period to enroll in either a Medicare Advantage plan or a standalone Part D prescription plan. But the catch is the Medigap plans, which is the other way of getting your Medicare benefits, are not part of that fall open enrollment period. Restated, there is no annual open enrollment period for Medigap plans. There's a once-in-your-lifetime open enrollment to have a guaranteed right to get those Medigap plans, and that's typically going to be when someone is new to Medicare Part B. So I know we covered a lot in such a short period, and I'm wondering, has anyone been confused out there about, what the availability is for these plans? I'm going to think that many of our listeners were under the assumption that if they have a Medigap plan, they can go to a Medicare Advantage plan, and then whenever they want to go back to a Medigap plan, they can do that during the open enrollment period. And it's okay if that's what you thought, but again, it's wrong, and the vast majority of people that we've come across get that wrong. And let me give you kind of some examples of where that can get someone in trouble. If they didn't know that they had that open flexibility to change plans, they could inadvertently join a plan and then find out a year or two later, when that plan may not be working for them, that they can never go back to the old style of plan that they had, that they're locked into that model of plan the rest of their life. So that's the one underlying thing with Medicare, is that when mistakes are made for Medicare, they often can stay with you for life. So let me get my contact information out there before we go much further. Again, my name is Dan Small, and I'm an independent broker that specializes in Medicare plans. And it's a great profession because my entire career, over 30 years, I've been helping people figure out what their health care options are, and Medicare with by far the most confusing part of health insurance. And there's no fee for our service. We get compensated by the insurance companies, and as that independent broker, we get to be objective. We really treat them for what they are. They're a commodity. You're going to need them unless you have an employer retiree plan where you don't need a private Medicare plan. But if you need a private Medicare plan, then we get to represent really all those plans. And again, without paying a fee for our service, we get to lay it all out for you. So we're located in Milford, right off of Route 1 and Thompsonville Road exit. And my phone number is 302-503-7013. Again, that's Silvertone Med Plans. And the email address, dansmall@comcast.net. And I do want to get our phone number out for any listeners that may want to call in. And that number, if you do have any questions now, it's 302-999-3733. 888-945-9292. We'd love to hear from you. Or pound 927 on your Verizon cell phone. All right, so let's go into the heart of things today. What are your Medicare options? So we're going to classify these as really two separate and distinct markets. They work different, they're priced different, and most important, they have different enrollment rules.
We're going to get a quick check of traffic and weather, and then more with Dan, the Medicare Man, when we come back.
Will you still need me? Will you still feed me when I'm 64?
All right. We're back and we're discussing Medicare, and today's topic, what are your Medicare options? So the two ways are original Medicare with a Medicare supplement, and in most cases, also a standalone prescription plan, and I refer to this market as the Medigap market. And the other way to go, or other market, is known as Medicare Advantage. And lately, I've been referring to these plans as the Joe Namath plans. They're the plans that you see all the TV ads for. So I'm going to first explain the Medigap market and then the Advantage plan market. And we'll save the Part D for last since the coverages are similar for Part D under both markets. So now, both markets have great value. And it's going to be that value proposition that you alone will decide. Now, I first learned of the term value when I was 6 years old. Now, do you remember collecting those green stamps and redeeming them for prizes? I remember doing that for a toy that I saw in a magazine, and I anxiously awaited that mailman. And upon delivery, I tore that box open. And to my dismay, I just saw this cheap plastic Cracker Jack-like toy. And I just couldn't believe that what I had seen in the ad that was so masterfully described could be such a piece of junk. And so, voicing my dismay, my mother nearby proclaimed to me, she said, "Danny, there is no such thing as a free lunch." Now, although I may have slipped on that concept over the years, it finally settled in, and I can tell you that I do know the definition of value, and I know what a Mickey Mouse watch is. So the point being, and the message on that is, you really shouldn't rely on those ad statements that you see. You have to get into the details of these plans. And note, I'm an independent Medicare advisor. I represent both markets, the Medigap and the Medicare Advantage plans, and each can be a good option, but there is definitely no one-size-fits-all. And that's going to be your value proposition. So your Medicare options are Medigap or Medicare Advantage. With a Medigap market, you use 3 cards. You show your original Medicare card. Medicare will process that claim at that 80% level. You'd show your Medigap card to cover most of that, if not all of that 20%. And unless you have like VA or union retiree coverage for prescriptions, you'd have a third card being a prescription drug card for your retail pharmacy. Now, there are many Medigap insurance companies, but the plan offerings are uniform from company to company. And for those that are now aging in, those plans are labeled Medigap Plan G as in George and N as in Nancy. And again, they'll cover that 20% with the exception of an annual deductible of $203. The Plan N puts in a $20 office visit copayment. So in summary, the Medigap market, you get almost 100% coverage. You're able to go to any provider in the country, but they do have a monthly premium, and those premiums are going to start out for someone 65 and the $100 range, but for someone they will increase as you age. And for someone that's 85, they could be paying $200 or more. So again, you'll need a standalone prescription plan in most cases if you're with the Medigap plan. There's about 30 plans to pick from. Their premiums range from $7, start around $7. They'll go up to $100. Most people are going to be in that $20 or under range in premium for those prescription plans. So that's the one way to go. Original Medicare with a Medigap plan and a standalone prescription plan. The Medigap plans, most important message for today, only provide a guaranteed once-in-your-lifetime open enrollment when you're new to Medicare Part B. The Medigap plans are not part of an annual open enrollment, and the rules are they have medical underwriting and have the ability to dig into your health history and say yes or no for anybody who applies outside of those periods. Now, the Part D standalone prescription plans, they do have an annual enrollment window to change or enroll, and that's at October 15th to December 7th. So let's get our contact information out there again. Dan Small with Silvertone Med Plans. We're independent brokers. We represent AARP, United Healthcare, Aetna, Humana, Highmark. Again, and many other companies. We're independent out there. The number is 302-503-7013. If you have any questions, give us a ring and we'll be happy to return your call and get those answered. If you have questions right now, you can call in at 302-945-9292. We'd love to hear from you, or that could be pound 927 on your Verizon cell phone. So that's the Medigap market. We're now going to segue into the Medicare Advantage Plan market. So what's a Medicare Advantage Plan? It's a contract between Medicare and the insurance companies where the government pays them to administer all the components of Medicare. The Part A, the B, and in most cases, the Part D. You still need to pay your Part B premium and retain Medicare, but in this case, you'd be leaving that Medicare card home in your dresser and just using that one Medicare Advantage card for whatever plan that you had selected. Now, most Medicare Advantage plans will use a defined network of providers, like an HMO or a PPO. And almost all of them will also use the copay platform. So the prior administration, being under President Trump, the Medicare Advantage payments increase considerably to the point where those plans that were costing about $100 a month now have that advertised benchmark premium of $0. So any local Medicare Advantage plan that's not a $0 in premium right now is really what we would refer to as a stale plan, and it really should be reviewed and upgraded, and that's where you would want to give us a call for that. Now, to increase the appeal of the Advantage plans, additional benefits are added in many of them, such as dental, vision, and hearing. And you can enroll in a Medicare Advantage plan when you're new to Medicare and annually during that October 15th to December 7th open enrollment. So that's a Medicare Advantage plan. It's a Medicare subcontracted plan with a network of providers and doctors, a copay platform with prescription drugs and additional benefits such as dental, vision, and hearing. And today, the benchmark monthly premium of $0 is really where those plans sit. Now, a $0 premium Medicare Advantage plan can save you money, especially if you're not real picky with the doctors that you use. But where they may not work is if you're using a lot of services, because that copay platform under an Advantage plan, those copayments really don't get capped until $5,000 to $7,000 on that one. So if someone is really sick using a lot of services, they have to navigate that network of providers and pay co-payments really as they use services, and those co-payments can really add up in that situation. And really, that's what needs to be everyone's value proposition, right? Because remember, you don't have an annual right to change back and forth between these markets. If you go into an Advantage plan and it's outside of that 1-year trial right, and we'll go into that in more detail when we cover Advantage plans just alone on that, you run the possible restriction of never being able to get back to a Medigap plan. And we do know one thing out there, right, is that this is health insurance, and health can change. So you're not only making that value proposition when you're new and you have a clean slate with both markets available to you. So when you're turning 65, you can either select an Advantage plan or go with the original Medicare and a Medigap. But you have to decide which one is going to work for you, not only now, but down the road if your health does change. And if that happens, where your health changes and you didn't plan accordingly, you may be stuck in the wrong plan for the rest of your life. So let me, again, get my contact information out there. I believe we're winding things down now. I thank you all for listening on this, what looks like it's going to be a sunny Saturday. We'll be back next week to discuss really when to sign up for Medicare. And there's some twists and turns in that category. Again, I'm Dan Small. You're listening to Dan the Medicare Man. We're independent brokers, Silvertone Med Plans, representing all the top companies. So we objectively get to bring that all together and focus on the education so you know you're making the best selection. The number is 302-503-7013, and we'll look forward to talking next week.